everyone. I'm so excited to visit the Children's Home.
The Children's Home has a 30-bed Pediatric Specialty Hospital where children come typically from an acute care hospital like Children's Hospital or a labor and delivery hospital, and we act as a bridge to home.
I'm excited to speak with Bethany, who is in charge of marketing, and she's also a program manager. And she will tell us more about the organization, its mission, and what kind of services you can receive here. So Bethany, tell us more about the Children's Home.
Sure. So the Children's Home has many programs to support children and families who have medical and social needs. Our founding program was adoption. It started about 131 years ago, and Erica, who's our director of counseling and family support services, is going to talk a little bit more about that. We also have a hospital, and that cares for children who need a bridge to home. So typically these kids will come from an acute care hospital, like Children's Hospital or labor and delivery hospital, and their families need to learn their care. So we specialize in teaching families and empowering them and giving them the confidence they need in order to take their child home and care for them themselves. Then we have a program called Child's Way, which is our daycare for kids who are medically fragile. Our daycare is the only one of its kind in Pennsylvania. It's licensed by both the Department of Health and the Department of Education, and is staffed with half nurses and half teachers. So our children will get a typical day in daycare, but they also will have all of their medical needs met, which allows parents to continue their education or to continue working, and they can have all of their therapy services while they're in Child's Way. So if they get early intervention, or if they see a vision specialist or a developmental specialist, all of that can be done right in Child's Way, kind of like a one-stop shop. Then we have our Pediatric VIEW Program. And Pediatric VIEW is a program that cares for children who have something called Cortical Visual Impairment. This is a visual impairment that is brain-based, so they can have an extremely healthy eye, but their brain and their eye are not communicating, so their brain cannot process what their eye is seeing. So we have one of a few specialists in the entire world. Her name is Dr. Roman-Lantzy, and she developed this program, and she puts interventions in place in order for these children to expand their functional vision, improving their quality of life by leaps and bounds. And then we also have a therapy program. So we have our own in-house therapists that work with our hospital kiddos, making sure that they get all of their physical, occupational, speech, developmental vision therapies while they're in the hospital, but then we also do outpatient services and are an early intervention provider. So we do a lot.
That's amazing. And can you tell us more about the hospital? Is it a nonprofit organization?
We're a nonprofit organization. So every child who admits to our hospital, their family does not receive a bill. It is free care for them. We do bill the insurance companies, and then we work really hard with grant funding and scholarships and fundraising to allow these families to not have the financial burden on their shoulders of the medical care that they get here.
And is it only for Pennsylvania residents or for Pittsburgh residents only?
It is not. So we only have our hospital here in Pittsburgh, but we get families that travel from long distances. So we get families traveling from out of state, from the other side of Pennsylvania, really seeking this specialized care and training that we provide here. We see a wide range of diagnosis in the hospital. We see children who are trach invented, whose family need to learn their care in order to take them home and for them to have a very full life at home, or a child who just got a G-tube and the family has to learn how to care for that and clean it, or children who are on IV antibiotics or are a poor feeder. The feeding program here, every single one of our clinicians, therapists to nurse practitioners to our physicians, all are trained in infant-driven feeding. So this is something we specialize in, and really it's to meet the family and the patient where they're at and train their family and their kiddo on how to meet their goals and get them home safely.
Oh, that's amazing.
It is.
In fact, so when you mentioned the feeding program, is it for infants only, or there are 3-year-olds or 5-year-olds who are not able to eat?
So the infant-driven feeding program is specific for infants, but we can do feeding therapy for all ages. We just specialize in infant-driven feeding.
I see. And what about therapy services? What kind of therapy is available to families?
So our therapy team is staffed with physical, occupational, speech therapists. We have a developmental therapist on staff, and then through our Pediatric VIEW Program, which I had kind of talked about a little bit, we do have vision services that do reach beyond cortical visual impairment, but yeah.
What about children with high anxiety or any mental health problems? Can they get therapy services here too?
So I will defer a little bit to Erica when she speaks with you for this. We have a very robust counseling program here that Erica leads. It started out really just counseling services surrounding adoption, pre and post adoption, and like everything we do, it's taken a holistic approach to the needs in our community, and it has kind of grown in ways that we could not have imagined, and propelled by Erica and her staff. So now it's goes far beyond just pre and post adoption services.
That's amazing. And do you have a long wait time for families to get the services?
Right now we don't. So we have immediate openings in our therapy department, in our counseling department to see a therapist. It does depend on, what the client is seeking, but yes, we do have openings.
So I heard you have a facility for families while a child is getting services at the hospital. Can you tell us more about that family living area?
Sure. So if there's a child that is admitted into our Pediatric Specialty Hospital, families are allowed to stay for free. So not only is the hospital a free service for families, but they can stay right in their child's room if they need to, but we also have a living area right down the hall from the hospital that families can stay. That's kind of like a hotel room setting, but then there's 2 common kitchens and living rooms. There's a pumping room for nursing mothers with hospital-grade pumps, and then help yourself cupboards in the kitchens for families to utilize when they need it. So a family can bring their other kids there while their child is in the hospital if they have multiple kiddos, and they can have time away from the chaos of a clinical setting and just have time to just be a family.
That's amazing. And is it also free?
It is free for families to stay if there's a need. And they can utilize Austin's playroom right there for siblings, and then we also have an outside all-accessible playground for kiddos that they can use if we're having a nice day. They're encouraged to use the playground.
Wonderful. And I heard that you have a fascinating playground also open to public, not just to people who are visiting the facility here?
Correct. We have 2 playgrounds. One is specific to our Child's Way kiddos who are in our daycare for medically fragile children. And then we have another playground that is open to the community and to our families that stay in the hospital.
That's amazing. That sounds like the best kept secret in Pennsylvania and beyond.
We just don't want to be the best kept secret. We would like to spread awareness as much as we can.
Absolutely, absolutely. Thank you so much.
Thank you.